when I've worked with patients who have come in with dementia-type problems as a new patient, if they're in their 50s, early 60s, maybe into the later 60s, I see pretty good results. But by 70, if that's going on, I don't see those same results. And it's almost like the sponge has had it. I don't mean to give up on them. I'm just saying I don't see the same results.
Welcome back to the Synapse Podcast. My name is Dr. Chris Leninger. I'm the founder of Synapse Continuing Education, and this podcast is all about connecting great minds. And we do that by having conversations about the future of healthcare. And today's really exciting because actually I have a group of doctors here, and we're going to be talking about the Diplomate in Chiropractic Craniocervical Junction Procedures put on by the ICA's Council on Upper Cervical Care. So with us, we have Dr. Jule Hunt. Thank you so much for coming.
Thank you for having me.
Dr. Hunt, she actually started the Diplomate program. She's one of the founders. It's a huge honor to have her. We also have Dr. Josh Silver. He has been really innovative, let's just say, in the upper cervical world, but he's actually going to be starting the Diplomate program this upcoming January. So he's been able to see, actually, I believe you and I were in clinic together, in practice together when I went through it. So he got to watch a lot of this firsthand. And then we also have Luca O'Brien. He's on the PR committee of the Upper Cervical Council, and he's also going to be starting the Diplomate program in January, right out of school, which is kind of unusual. So I think we're going to have a fun conversation today. So yeah, I think it's going to be awesome. So Dr. Hunt, I wanted to start with you because you're really one of the people that helped shape this entire program, helped mold it over the years, helped adapt as we've run into obstacle after obstacle. But I'd sure love if you could just take a moment and really share the heart behind like why the Diplomate program even came to be in the first place.
Well, I have to thank Dr. Jerry Klum. He invited all of the upper cervical organizations together out to Life West in 2008. And in fact, my son, Dr. Travis Hunt, he was in high school at the time, but he went with me because I knew this was going to be a huge part of our profession to accomplish this. And so Dr. Klum gathered all of the upper cervical organizations together, and we had a meeting on how we could collaboratively help, understand and explore the cranial cervical junction collaboratively versus everybody being in their own field. Mm-hmm. And so we picked a group, myself included, from each one of the organizations to participate as a council, and we started our council meetings shortly thereafter to coordinate and put the Diplomate together. And there was a lot of hiccups that occur in any of those type of processes, but we got through it. And we brought Dr. Bo Rochester on to head up research. And then as it worked out, I ended up handling curriculum for the Diplomate. And that was something that I needed Dr. Bo Rochester on as well. So Dr. Bo Rochester and I were co-curriculum heads to put the curriculum together for the Diplomate program.
So when you talk about the Diplomate program, when you were thinking about what it will do for our profession, like I'm talking like the hearts and dreams side of it. Like, what was your dream in seeing this Diplomate come to fruition?
Well, number one, there's so much research that was occurring starting at that time on fluid flow to the brain and the importance of brain health and the lymphatic system that they were just going to be finding shortly thereafter that. But the fluid flow dynamics to the brain, as much as my first 30 years of practice, I was focused on getting signals from the brain to the body effectively. Once I understood that when this head neck region isn't balanced, the brain isn't getting what it needs to stay healthy, that's a whole new dynamic. And so at the end of the day, it's about brain health and understanding the importance and critical nature of keeping this cranial cervical junction functional to maintain our brain health. I mean, you know, I love to move my right and my left leg, but I'd still want to be able to think.
Yeah. So a lot of it was really around shaping the advancement of our understanding of what we were even doing, and then based on that, how to do it better?
Yes.
Okay.
How to do it much better.
Yeah.
because it's critically important that our brains get the fluid it needs to not only function, but to clean and wash itself and keep it from neurodegenerative diseases. And, it's very interesting. The practice that I'm in is my father's practice, and my son is now there with me. And in 65 years, we have never had an established patient develop MS, ever. We've had 2 patients develop dementia-type involvements, and it's a mother-daughter, and I really don't understand exactly why that went on. But other than that, we haven't seen patients, develop neurodegenerative conditions that are wellness care patients that have been with us. I mean, this one little girl started with us when she was 4 years old back in 59, and she was having 200 seizures a day. And the parents had been told medically to put her in a home and forget about her. And there was a new chiropractor in town that saw kids, and so they took a chance and brought her to my dad, and within the next 2 weeks, her seizures dropped to almost nothing. She's been in wellness care all these years as a patient, and, if she's in a fall, an accident, she's never driven, but she went to JC, she finished high school. But, anytime she's injured, the seizures come back, we get her under care, they all clear up. I mean, we're talking over 60 years of seizure management.
Yeah. So this information, as it was developing, you realized it wasn't common knowledge for us,
Right.
but it had to be.
It had to be.
Yeah.
Yeah, we need to understand, at the end of the day, we want our brain health.
Yeah. And since then, have you seen the program evolve more than even what you dreamed?
So much more than what I could have imagined.
Yeah.
I mean, it's really breathtaking to see the differences we can make. Just in understanding when you're looking at that fluid flow, when I'm up at Dr. Rosa, who is the lead of the cerebral spinal fluid research out of New York,
Yep.
when we're there working with patients that are flying in from all over to see him, and you have a Parkinson's patient and you see the fluid flow to the fourth ventricle is non-functional before the adjustment. After the adjustment, the fluid flow is almost normal to the fourth ventricle, measurably improved. And then the patient's like able to walk and they have much less tremors. And I'm like, it makes so much sense.
Yeah.
We've got to look at this. We've got to stop just saying Parkinson's came from nowhere. It's a fourth ventricle issue. I agree with them, but it's a fluid flow dynamic that's so simple to understand.
Yeah.
It's a kink in the hose.
Literally. Literally. So, Luca, over to you real quick. So, you are 2 weeks away from graduating, right? Which is pretty
so
awesome.
awesome.
Congratulations. Thank you. Now, you are doing something most people would not. And half of us, at least, would almost steer you away from, but it's bold. And you're jumping right from school right into the diplomate program. Now, why did you decide to do that? Sincerely.
Well, I think I've been very blessed to be able to attend the Upper Cervical Forum for the past 3 years. And every year I go back, there's just something that just blows me away that I didn't even know was being studied, right? Like upright MRI and upper cervical and being able to see the pre and post changes, like something that we don't even get that exposure in school. And, Dr. Hunt did a really good job of saying you don't know what you don't know. But once you get exposed to it year after year after year, you're like, wow, there's so much out there. And these standards that are really being created and the upper cervical counselor is something that I really admire to aspire to. So for me, my sister's husband, he's doing his residency in orthopedic surgery at Stanford. And we talk a little bit about, kind of upper cervical and his world and things like that. And he was like, well, it makes a lot of sense that you would want to pursue this specialty because it seems like very specialty work. And it seems like it would make a lot of sense that you kind of have your 3.5 years of chiropractic school, and then you would go right into that specialty, almost like him with his medical school and how he kind of gets that general knowledge of being a medical doctor. And then he goes into specialty of orthopedic surgery and he goes right in there and he's able to kind of have the mentorship with that teaching hospital to be able to make sure that they're really practicing at that standard that they're setting. And I think for me, I've really become inspired to be able to go into upper cervical, right after school and to really do it at my best ability and to be able to kind of train with some mentors that are in the upper cervical world and be able to kind of have their guidance and be able to work at their clinics so that I can really be able to see kind of what the standards are being established and be able to kind of go in that track.
So
That
yeah,
makes sense.
no, you want to start with extremely high standards.
Yeah.
That's what it sounds like to me,
Yeah.
at least. But it's a bold move, and I think it's going to turn out well. I think you have the right character and demeanor to go into it the right way. But if you struggle along the way, we'll all come along and kick your
It
butt.
takes having a beard, right?
It does, apparently. Yeah. I'm sorry you feel alone. Very cool. So the program at this point, this is the fourth iteration.
Yes.
I remember the first one started when I was actually in chiropractic school.
2013.
And we're starting to get a good lineup of doctors that are signing up. But and there's also some room at this point.
There is.
Yeah.
Yeah. We're planning on creating an abundance of attendees because it's something that we can't be running 2 programs at one time.
Mm-hmm.
So we're really set to be able to handle the best that we can moving forward.
Yeah. Now, if somebody was interested, like both of you are very interested, I've been through the program before. I know I'll say from my standpoint, I looked at it and I got to the point in practice where I'm like, okay, there are these groups of people. I just literally don't have the information to understand what's going on. I could tell them about the philosophy of chiropractic all day long, but there's an obvious obstruction, interference, or something I can't see. And I just want to see it so I can deal with it.
Right.
And if I can't deal with it, at least I can communicate it.
Right.
And if I need to co-manage it, I understand when, why, and where.
Exactly.
That's I think been the biggest draw from anybody I've talked to on why people go through the program.
Yeah. And it connects dots that have never been able to be connected.
Yeah.
Honestly, when I did that first research with Dr. Rosa and I saw the change in the fluid flow to the brain and the difference when a patient is laying down, when you lay down, the back of the head acts like something of a bowl and the belly of the brain tends to slide into the bottom of the bowl. And when you sit upright, that brain sits down further into the opening of the spinal cord. And so when somebody has a headache, that explained to me why they like to lay down, because they're getting tissue out of the way so they get better fluid flow, because you see totally different imaging from upright versus laying down. And I'm like, I've seen that all these years that patients with headaches like to lay down by and large, 98%. And that made perfect sense why.
Yeah.
And that was something that I had always been aware of, but I couldn't connect the dots.
Yep. Yeah. So I know that the Diplomate covers a lot about the cerebrospinal fluid flow, the positioning,
the blood flow.
I love how you're putting it. It's connecting the dots. It's not learning new anatomy. It's how the anatomy, the physiology, the positioning, and the functionality, the biomechanics work together, intertwined.
And to listen to the patient.
Yeah.
So what I had a young woman in today. She's from South Africa. I've still got to get somebody trained in South Africa for her. But anyhow, she's had headaches, for most of her life. She's in her early 20s, and now she has anxiety and depression. Well, what I have seen now that I have the dots connected is that when the brain isn't getting proper fluid flow, it's like the heart not getting proper fluid flow. If your heart wasn't getting the fluid that it needed, could the tissue get irritable? Well, that's the brain with anxiety. It gets irritable. But if it stays irritated long enough, it starts to shut down. That's the depression.
Got it.
So her headaches and neck pain are, measurably better, but her anxiety is still not changed. But that's going to take that 120 days for the neurological cleaning and washing of the brain, because it's not getting the fluid it needs. It's backed up and toxic.
Yeah.
And then there's the whole immune connection, that when this nervous system isn't properly functioning, your immune system is measurably compromised. And what we're seeing these days with Lyme and all sorts of, autoimmune situations going on, creating toxicity in the body, those are in the patients that are compromised neurologically. You have to look at that, and the pieces connect.
Yeah.
And a really important point is that when I've worked with patients who have come in with dementia-type problems as a new patient, if they're in their 50s, early 60s, maybe into the later 60s, I see pretty good results. But by 70, if that's going on, I don't see those same results. And it's almost like the sponge has had it. I don't mean to give up on them. I'm just saying I don't see the same results. Like if you look at the online link of Jim McMahon and Scott Rosa in upper cervical, I mean, he's the funniest thing ever. I mean, he just, he said the first time Dr. Rosa got him adjusted, it felt like the toilet flushed. He didn't have any bad suicidal thoughts. He had, but he was in his 50s, not his 80s. And so it's really important that we understand it's not only essential to start chiropractic care from birth, but particularly as we move forward to take care of that brain. I will share with you one time I was presenting at a Florida Chiropractic Society conference, and there were maybe 400 or 500 docs in the room. And I was showing pre and post changes, MRIs, and this and that and the other. And this one really big guy up front raises his hand. And he said, "What type of adjusting procedure are you using?" And I said, "I'm using an image-guided adjusting procedure," because I knew if I used anything rote like upper cervical, I was going to lose half the crowd. And he goes, "Well, what is that? Just a bigger hammer?" And I will swear to you, God gave me these words because I had never thought of them. I said, "Well, it would depend on how you would treat your Rolex. This is your brainstem." And I didn't lose the crowd. Everybody was like, "Oh, okay."
Yeah. That's a good example of as you go through the course, as you go through the diplomate program, as you get immersed in the culture, I think is a better way to put it. You're not just learning the technological side of becoming a diplomate of upper cervical care and the various procedures and the anatomy and physiology. You're learning a language too.
Yes.
And I've used this analogy so many times that, if I'm an American, I want to travel to Germany, I don't expect that everybody I come across will just instantly switch to English for me. Right? I'm the rude traveler at that point. But if instead I take the time out of my day to prepare myself for my trip and I learn some German, I become a better guest, and it actually makes it easier for them to be a good host. And so when we try to go and explain our work into a medical culture, whether it be the medical doctors, the nurses, like the medical community, or even the general American public, which speaks more medical than chiropractic, we're the rude American traveler.
Yes.
We want them to cave to our language instead of just learning theirs. And I think one of the best benefits, it's not the only one, but it's a notable benefit to especially the growth of my practice, was the ability to speak a new language.
Yes.
One that more of our nation could understand.
Yes.
But it never changed what I believed about how the body works.
Right.
Right.
And, one of the joys, and I'm sure you all have seen this, is when a medical physician comes into your practice, one of the first things I do is have him come and observe me treat a patient or two, or have her observe me treat a patient or two, because all of a sudden you can see them start to breathe. Okay. Because they really don't know what to expect.
True.
And, like this orthopedic spine surgeon who's the top in our area, he called me one day. He said, would you be able to take on a 50-year-old cantankerous male? And I said, "Okay, what time do you want to get in?" But anyhow, he once I got him adjusted, he said, "Julie, you could put me out of business." I said, "That is my quest every day." I want to help people stay out of spine surgery and take care of their spines. Dentists want to have you keep your teeth. I want you to keep your spine.
Yeah.
Not wait till you're at the levels where you have to pull teeth and go through all of that.
Mm-hmm.
But, surgeons, physicians, nurses, nurse practitioners, when they come in and they get under care, they are my biggest referral source. I mean, they love the work that we're doing because they know, number one, it's precise. If you take your time and go about this carefully, you don't have to be hard on people.
Mm-hmm.
That's priceless.
I would just say one of the things I've really appreciated about a lot of people in the diplomate program is they are diplomatic diplomates, right? The way that they create relationships with other healthcare professionals is very diplomatically, and they're able to show the level of knowledge that they have and the level of expertise through the additional training in the diplomate program to really start being able to extend that helping hand and build more relationships, because ultimately it's about the patient at the end of the day and being able to get the best results for them.
Amen.
Yeah, I know one word I've started to use, or one phrase, is within our culture, we use the term innate intelligence to describe what's happening in the body, but that literally does not translate into most of our culture. So, but if you talk to the medical community, I started using the term autonomic adaptability, which is literally the exact same thing.
Exactly.
But it's translated into the language that's known. And I never, ever lose them.
Yeah.
Because they understand those two words, and you put them together and they're like, oh, yeah, that's a perfect descriptor of what you're talking about.
That's correct.
And if you start breaking down, like, well, it's autonomic adaptability to sweat when you're hot. It's autonomic adaptability to release adrenaline when you're scared. And they're like, yeah, that makes sense. You never lose them. But as soon as I'm with a chiropractor, they get offended sometimes. And I'm like, look, if I was to travel anywhere, if I could, I mean, I'm terrible. I speak Spanglish in Spain, and my wife is born and raised, and like, she just is like, I have nothing to do with him. She like walks away from me. It's hilarious. But like, the more I spend time just learning how to translate into the appropriate right words, the more she wants to hang out with me. And I like that better. So like, I want to be able to hang out with chiropractors, obviously, but there is a huge portion of the United States of America that needs to be reached, and they're only going to be reached through trust. And the only way we're going to establish trust is not by hammering this nation into submission, but being able to translate and use language they understand to address their concerns and their fears in a tangible way with results. And I think this program does both. Prepares us for the communication necessary and the ability to get the results necessary to actually make an impact in an area we've not made an impact in a long time.
Yeah, Dr. Travis, my son, as I said, went out with me in 2008 to Life West to be part of just being with me to get this program going. Mm-hmm. And he is so excited to start with you and Josh, and Dustin Dingus is starting. Pretty incredible connections there, and just excited to see this whole program moving into this fourth round.
One of the things I really appreciate about the diplomates, the fellows, and the council, it's not just the information, it's not just the standards, but it is the shift in the culture. And I know there's been some opposition by a lot of the philosophical heavy groups. And it's not to point anybody out, but no. I actually think a lot of that is just from a misunderstanding. What do you think about that?
I concur. It's misunderstanding. They're thinking we're not focusing enough on the philosophy, that we're leaning too heavy on the science. Mm-hmm. But the philosophy is the root of everything we do. The science just improves it.
Yes. Yeah. That's what I've seen. And I mean, Luca, you've gotten to know a lot of doctors. You've done a lot of one-on-one interviews, and you've done a lot of it with the diplomates, right? So people that are very heavily involved with the council, the diplomate program. In your experience talking with all these people, do you feel like these doctors like are steering away from philosophy? Like, just from your personal perspective, what do you see?
Not at all. I would say anytime you ask someone why they do something, that's a philosophical question, right? Why are you adjusting the atlas? Why does this improve someone's health? So your philosophy is really just the justification for all of the whys that people are asking you. Why should I see a chiropractor? Why should I see an upper cervical chiropractor? Really understanding your philosophy is understanding the why behind what you're doing. And like you said, that is the foundation for everything. I think being able to understand the what, right, is more of like the science. And I think the Upper Cervical Council just wants us to be able to kind of organize on elevating that science because we have such a strong philosophy. I think that's one thing about chiropractic, has probably one of the strongest philosophies out of any healthcare profession that I've been able to witness. And I think having that as a really sturdy foundation allows us to be able to really build that strong house. And I think that's really what the council is doing. So that's what I hear from a lot of people.
Yeah. So then let's just talk a little bit more practical about the actual program. So the new program will start January of 2024, yes. Right? So what are some of the details people need to know about the program?
So in the first year, a lot of it is baseline anatomy, neurology, philosophy, And then at the end of year 1, we start with some of the advanced imaging with MRI, with Dr. Rosa, et cetera. And then year 2 gets more into understanding the different procedures and how they can, how I can better understand AO, or if you will, knee chest, or, toggle, or whatever that is, to better understand how to help communicate what research we're seeing and then build it together.
So it's like cross technique collaboration,
Yeah,
essentially.
there's a couple modules on that.
Okay.
And then there's, of course, advanced imaging. We have radiologists presenting as well to move some of that research forward on the advanced imaging. And, then we move into some specifics like the TMJ and the Atlas, the connection there, the work that's being done with dentistry and upper cervical doctors to get those two connections clarified, because they do work well off each other. We need to understand that. If there's a jaw problem that's driving the neck problem, or vice versa, and make sure we're on top of both of those. I mean, there's many pieces there. So we get into some specifics, dynamics of things that we work with, whether it's trigeminal, whether it's, any of the ocular issues, all of that parameter.
Awesome. And then and year 3, you covered a lot of that, right?
Yeah. So again, we're always building year 3.
Yeah.
I always leave room for year 3 because I know there's always new advancements that we need to include in the program to move it forward. So we get through year 1, then we have our year 2, and then I always have room in year 3 to include new programs, new advancements.
But it's always robust.
Yes. It's always, I've attended so many of the.
Yeah. So it's a 3-year program.
Yes.
And how many modules?
So technically, a 3-year program should be 30 modules, but out of that, 4 of those modules, we allow a lot to each of the procedures. Like, what upper cervical procedure are you inclined to practice?
I believe NUCA.
Okay, so NUCA has a certification procedure. So we allot you to get your certification through 4 of those modules, if you will. We give you credit for 4 modules because that's what it's going to take to get certified in NUCA. Okay. Same thing with AO or orthospinology.
Okay.
We allot some of those modules, and as the program moves forward and we need to build that year 3 more, those modules will diminish that we allot, but we still have to have the certification in each of the procedures for you to have your diplomate.
Yep. So by the time you graduate, you need to be certified in at least one technique.
In one procedure.
Okay.
Yeah.
Perfect. And so the cost of the first year tuition, important details, right?
I think it's around $4,500. Don't quote me on that. $4,250.
Okay. Good.
Yeah, we just registered, so we know.
Okay.
Yeah. No, it's a big commitment.
But you have to understand, what are they paying a quarter these days at school?
Oh, for me, it was the greatest investment I ever made.
Yeah,
because I'm paying $10,000 a quarter.
A quarter.
And
this is a
the
whole
value
year
that I feel like is associated could
Yeah.
be varied, right?
Yeah.
But this is a great deal.
Yeah, these are 10 modules that, yes, there's going to be travel involved and so forth, but, you figure that out.
And some of the main locations?
So I know Atlanta we're using. We're also using
Chicago?
No, we're doing only 2 modules in Chicago. I'm minimizing Chicago because some of the stuff that's going on in Chicago, and I'm trying to think of the other locations. They're not on my head at the moment.
I know it's all on the website. So it'll be icauppercervical.com.
Yes.
We'll have all these details.
Yes.
But I just wanted everybody to be able to hear a little bit more about it.
Yeah.
Yeah, the instructors, I know the instructor lineup is awesome.
Yes, it is.
Just it's
the best.
I know
of the
that
best.
the best of the best in each relevant topic.
Exactly.
So you're not just learning from an instructor that happened to be available.
Not at all.
It's people in the top of their game on
Yes.
that topic.
Yes.
Yeah. And I know I enjoyed every bit of it. I'm excited for both of you guys because
Where's the first class at?
So the first one is going to be Dr. Kessinger in Atlanta,
Right.
January
And
20th
then the
and
second
21st.
one is,
The second one, I believe, is it?
it's in Michigan?
Is it Minneapolis?
Minneapolis.
Yeah.
That's what it is. The M word was there.
Yeah.
No, that's good. That's good. And so if you were to pinpoint kind of who's the ideal candidate for somebody who should consider doing this diplomate program, who would you say is ideal?
I would say anybody who's in an upper cervical procedure, this would just grow their basis of care for their patients immeasurably. From a starting point, I think that's where we need to start from. I know that we have several candidates who are not in upper cervical procedures, but they're going to be at the ground level. People who have an upper cervical procedure like Luca or AO Advanced. Okay. You're going to come in you're going to come up a couple levels ahead.
Mm-hmm. Well, the nice thing is we've had doctors successfully go through not even starting as an upper cervical doctor and finishing practicing exclusively as a diplomate in upper cervical procedures and successfully.
Very successful.
So it's really cool to see that this isn't a program that's just for someone who's already established in this, but it's a program that's so robust and considers all the bases necessary to actually come out doing it.
Yes.
And not just theorizing about it.
And caring for that patient at a level that you will hear things that will click things in your mind that goes, okay, we need to look at this because there is possibly this consideration. We don't have all the answers, but I have so many more answers than I ever used to.
Mm-hmm. Yeah. Very cool.
I'm excited for the Beard Fest. Obviously, that's a plus. But I'm just excited because there's a wide array of different people that are coming into the next class, and I think I'm really just excited to be able to hear everyone's perspectives. And like you said, I've been able to diplomate. I've been able to interview some of the diplomates, and I think the one thing that they all say, which is pretty interesting, is they say these are the best friends that you're going to have for the rest of your life. They're like the friendships that you form in the diplomate program are a lifetime.
They are.
So if you're looking for friends, me and Dr. Silver are pretty friendly people. So.
Well, and we're talking committed friends that you can go to with a problem case and really vet it out.
Yeah.
That's...
Everyone has a different background. So, a lot of the people that I've talked to, the diplomates, they're like, I know I have at least 5 people that I could just call them on speed dial and whatever they were doing, they would drop it to be able to help me.
Absolutely.
And I think that the value of being able to have that community, it's like a professional community you're being able to form. And I think a lot about not how I'm going to do something, but who is going to be able to help me. And I think the diplomate program is giving you all of those who's surrounded to be able to accomplish your goals. Yeah.
I have a quick story on that. Just the community. The reason why I joined the diplomate was actually the way you treated both me and my patient simultaneously. Because I ran into a case that was honestly above my head. It was, and it was things I couldn't see, and I didn't have anybody at the time that I knew to reach out to. But it seemed like something that I had heard Dr. Hunt had been starting to deal with. So I called her up and she said, yep, she's absolutely out of your realm. But at the same time, she affirmed I want this to be a great transfer. So I sat down with the patient. I said, listen, this is a lot more complicated than I'm used to. I have a colleague that really could bring it to the next level beyond what I'm used to. It was one of the best transfers still to this day, but that patient ended up calling me, visiting me, kept me up to date on all the advancements. She ended up going up to see Dr. Rosa and still thanked me for referring out. And I saw the way that you cared for the patient. I saw the way Dr. Rosa explained just step by step everything that was going on, proof through imaging, explaining the connections, broke it down in simple language. And I just sat there and I go, I have to do this. I can't just refer for this. I have to become this.
I remember we did a go-to-meeting call.
We did.
You were on it, and I remember your response. I've got to do this. I just learned more in the last hour than I've known in years.
Yeah, and it was it was welcoming because I didn't feel like I was competing anymore.
No.
It felt like we were working together for people.
Absolutely.
And you and I practiced miles from each other, co-managed I don't know how many patients at this point. I have never once felt a sense of competition. I felt collaboration.
Yes.
I felt like I get refined, challenged.
Yeah.
even given opportunities to grow. Like sometimes you send me a hard one just to see what I'm going to do. No, that's what it feels like. But it's based on a level of trust being like grown into it. And Dr. Josh now works miles too. Yeah. And same thing. Like there's collaboration and that culture is just raising the bar where we're helping more people and more people are realizing this is the norm. And
we're working collaboratively together. And there are times that in the orthogonal world where we have that patient that's off, 0.6 degrees. And you look at the rotation and you look at this and that, and then you start looking at all the articulations and how everything is built. And you get almost a sense that sometimes it's jammed against the grain. And then as you look at your post x-rays and you see things unlock and return to a normal for the grain of the joint, if you will, and then see patterns that are normal moving forward. I mean, there's lots of pieces to that, but it's so wonderful to have that input as you look at images. It's not either or, it's more of a collaborative. But what you'll find more often is that if it looks against the grain, once you make that adjustment from the first time, you'll see that whatever happened to that joint to jam it against the grain, it'll unlock and you'll see the true pattern. It's really awesome.
Well, that's awesome. I'm excited for you guys. I'm excited for this program coming up. So if you're interested in learning more about the Diplomate program, the Diplomate in Chiropractic Craniocervical Junction Procedures, you want to go to icauppercervical.com. All the details about the program, the entire curriculum, where it's going to be, registration, it's all going to be on that website. You can always reach out to one of the diplomates if you have any more questions. You can reach out to Dr. Hunt if you have any more questions, to myself. But there are a lot of doctors who have been through this program at this point, and any one of them is going to be able to tell you about the program, what you're going to learn through it. And hopefully this is something that if you're in the upper cervical world or even in the chiropractic world and you're like, hey, I'm just going to jump off the cliff, this is definitely something you want to consider doing. And I just want to say, Synapse Continuing Education is this type of conversation is exactly what it's for. Synapse is not supposed to be a replacement for things that are happening within these organizations. It's just a broadcast platform to bring some of the coolest and most impactful advances in healthcare into a larger conversation so that all of healthcare can raise together. If we do that, then we're going to be changing patients' lives by getting them the care that they need. So thanks for joining the podcast. Thank you, Dr. Hunt, for being on.
Thank you.
Thank you, Luca, for being on. Dr. Silver, thank you for being on. Really appreciate your time.
Honored. Appreciate you.
It's been a blessing. Thank you.